guys, Dr. Christy Ennis. Today we are going to go over some treatment to fix that disc issue that's going on in your back. Now, sometimes it's very scary to hear those words, bulging disc, right? Or herniated disc. Fear not. More often than not, you can fix these things with some exercises that I'm going to show, or even just time, believe it or not. And surgery is very rarely indicated, okay? So that's good news. Now, what's the difference here? So a bulging disc, the disc itself is like a hard cartilage outside and then a soft center, like a yummy jelly donut, or like a Tootsie Roll Pop, right? How many licks does it take to get to the center? See who remembers that one. So a bulging disc, think about it like a guy at the gym in his tight t-shirt, right? It looks like his muscles are going to come out, but they haven't quite popped out. And that is a bulging disc. That material hasn't come all the way out yet. Whereas in a herniation, a herniated disc, that little jelly material tends to kind of slide outside of that cartilage and can push on the nerve. But more often than not, it's not even a nerve compression. There's inflammation, and then that inflammation is causing some compression in through the nerve. So there's lots of ways to work on that. So I'm going to show you a good old Bert E. Bray here. Poor Bert can't fix his problem, so just poor Bert. But you can see this is the disc, and of course it's the red, so you can see it, just like raspberry jam. No, only one man would dare give me the raspberry. But you can see if this comes out, it can press on that nerve. No, it doesn't have to, but it can, and that can send some of that pain down the leg. So what the heck do you do? Number one, I'm going to stand on up here. Very often, your body tries to shift away from that darn disc, okay? So this is an exaggeration, but I have seen this in people. So you want to, number one, fix this shift first. Before you go into anything else, or the other exercises really don't matter that much, okay? So walk this way. No, this way, right? You're going to head to the wall. If I'm shifted this way, I'm going to rest my arm against the wall, sup, bring my legs out a little bit, and then I'm going to gently put my hand on my hip, and I'm pressing that hip into the wall. Do not make this hurt, okay? So even if that means you just do a little bit, that's okay. If it feels good, then you can even add a little neck side bend in, like a German Shepherd looking at you, wondering what the heck you're saying. Only though if that feels okay, right? So about 10 to 15 reps there, and then hopefully you'll be standing with lovely posture by the time you're done. 2 to 3 times a day for that one. Now, I know I said that it can compress the nerve and it can cause pain in through the leg. One of the other things, though, that can happen are these muscles alongside the spine, called your paraspinal muscles, tend to go into spasm because they're protecting that spine. And so sometimes pain itself can just come from those muscles. So if you take a sock, which is my beautiful turtle sock, I like turtles, take 2 tennis balls and put it in and have a little bit of a space in there. If you take and go against the wall, generally speaking, versus lying down to start, alongside the spine, you're going to look like a bear scratching its back. And you're just going to do a little roll up and down. So you're not getting the spine itself, but you're getting those muscles alongside the spine to try to loosen those up a little. Like I said, a lot of time, that helps some of the pain. Yay. All right. And you're doing that until it feels a little bit better, okay? If it's not enough pressure, you can go ahead and lie on down on the ground to do that. I'm just going to get these out of the way. The next step is decompressing that spine. So trying to take some pressure off of that whole area. And there are several ways to go about doing this. I'm actually going to open my door. I don't know if I've ever shown you my hallway before. But if you have a doorway at home, which most people do, you're going to do a little bit of your own self-traction. So I'm going to hang on to the door, reach on up with my monkey arms. My feet are still on the ground, and I'm going to let my weight now drop. You do want your feet on the ground, so you could always do this with a pull-up bar if you happen to have one. I do not have one in my office. And it, again, should be like, oh, okay, that feels good. If this hurts, do not do this one either. Now, if you do not have either of those options, or those options don't feel comfortable, you have a couple other ones. You can take 2 chairs that are the same height and are sturdy. I don't happen to have that in here right now. And you can hang right on those, okay? Again, letting your body weight drop, keeping your feet on the ground. The other thing that I often have people do is go into the pool. And if you've got a lovely little noodle, you can let your legs just hang in the deep end. And just that weight of the water sometimes feels really good. I have had people that'll put ankle weights on their feet too to also help with that. And lastly, if you have a good buddy at home who's willing to help you out, they can actually pull on your legs, not your finger, pull your legs to get a little bit of that distraction as well. You're doing it for a couple minutes generally at a time, and you can do it a few times a day. Again, only if it feels good. Now, lastly, you want to do what we call extension exercises. Usually, not all the time, but usually, bending forward makes things a heck of a lot worse. And actually, if there's any nerve smushing, it gets smushed even more. So if bending forward hurts you, don't do it. Duh. But what we want to do is actually go in the opposite direction to try to take that pressure off. So if you're standing, I'm going to pull my shirt again. You're going to take kind of where those dimples are and just support there. Keep your hands pressed down towards your hips. And then you're going to go backwards. I'm going to turn this way. You're just going to lean back. Again, 10 to 15 reps. You're only going to the point where it feels okay, right? Not pain. Nothing should be getting worse here. All right, so that you can do frequently throughout the day because a lot of times we stand during the day. Generally speaking, starting, sometimes that doesn't feel comfortable either, that standing. But if you can get on your bed or on the ground, onto your stomach, hands are going to go underneath here to help support you. You want to make sure you keep your pelvis on the ground as you do this, and it's just a little press up. Okay, sometimes you have to start with a pillow underneath your hips. Sometimes that feels a little bit better. If that feels good, you can go ahead and try to extend even a little bit more. But again, don't be doing any flying pelvic moves here, okay? Keep that pelvis right on that ground. Now, if you have leg pain and your leg pain gets better, but your back pain gets a little worse, it's actually a good sign, believe it or not. So keep that in mind. That usually means that there's compression that's coming off of the nerve then. So there you have it. You got a nice routine to get you going. If you liked this information, please like, subscribe, and any comments that you have, I'm more than happy to answer. Thanks, guys.